Kidney failure you can't ignore. We'll discuss chronic kidney disease symptoms. I'll show how to protect your kidney. Why is this important to know? First, chronic kidney disease is silent. Often, it's discovered when irreversible. Second, it's a growing global problem. Nearly 1 billion have it in the US. 1 in 7 people suffer from this. As I said, it's a silent disease. Half learn they have it when dialysis starts. That's when kidneys stop working. I'll divide this video into 2 parts. First, kidney disease signs and symptoms. So what signs can you see or feel that might indicate something's wrong with your kidney? In the second part, which I consider most important, we'll discuss how to prevent kidney. I'll show you habits for if you want to protect your kidneys' health. Folks, let's start by giving this video a like. Because when you like it, you help those without access to doctors, those who can't access hospitals or don't have health insurance, to learn about chronic kidney disease. This video is a public service, so like and share it now. Tell me in the chat or comments where in Brazil or the world you're watching from. I'm in Rio de Janeiro, Brazil. How about you? Where are you? Write in the chat or comments, and also let me know if you have any stage of chronic kidney disease. All right, everyone. Let's begin. Our first symptom, okay? Remember, I'll discuss 6 symptoms today. The last one, I'll do a count. The last symptom, actually the first, might indicate kidney. Pay close attention, as this health issue could signal kid to be aware, okay? So, our 6th symptom is changes in urination. Our kidneys, among other functions, produce urine. When kidneys fail, urine production changes too. You may urinate more often, less volume, very pale, or get up more at night. This could also indicate heart, prostate, or urinary tract issue. Foamy urine suggests excess protein, indicating kidney disease. If someone urinates less due to reduced kidney function, limiting waste and toxin removal, this can indicate kidney disease. Urine may be darker than usual, possibly containing blood. When we see this, we first need to investigate the cause of the problem, identify the root cause, address it, and if possible, ensure proper hydration, control blood pressure, and take other related measures. Our 5th symptom is fatigue or tired. Why? Besides making urine, kidneys produce erythropoietin, hormone that stimulates red blood cell production, which carry oxygen. So when our kidneys don't function well, we don't produce enough erythropoietin. Then what happens? We develop anemia. And what does a person with anemia feel? Fatigue sets in quickly as both muscles and brain tire fast. So if we're dealing with someone who has anemia and chronic kidney disease, possibly with iron deficiency, we need to replenish iron and administer erythropoietin to this person. People with kidney disease often suffer from anemia as well. The 4th symptom is electrolyte imbalance because kidneys, let me list their functions here, produce urine, make erythropoietin, regulate calcium, sodium, and potassium. When kidneys don't function properly, they work well, but some salts like potassium may accumulate. This can cause serious issues called hyperkalemia, which can even be fatal. How do we treat and control this problem? People with chronic kidney disease must watch their potassium intake. So, when we discuss certain foods here, if they are high in potassium, we always warn that for those with severe chronic kidney disease, they should be cautious with that food, okay? Bananas, for example, are high in potassium. The 3rd symptom is nausea and vomiting. What happens when a person has failing or weak genes? Waste and toxins build up in the blood, causing uremia. Uremia can lead to irritation, digestive issues, and bad breath. So we need to identify the cause, treat it, and reverse the reason for uremia, right? We must diagnose what's causing kidney failure and, if possible, treat that issue. The 2nd sign, folks, which is also very common, is edema or swelling. As I mentioned, kidneys control mineral salt balance and the body's fluid levels. When our kidneys don't work, they can't excrete excess fluids from our blood through urine. So if you drink too much water and your kidneys don't work, what happens? That water stays in your legs, arms, and face. When kidneys are weak, they can't remove excess fluid, causing swelling or edema. Other conditions, like heart disease, can also cause this swelling. But what's the difference? In heart disease, swelling usually occurs only in the leg. With kidney issues, hands, arms, face, and eyelids swell. Treatment involves restricting fluid intake. If someone has a severe kidney problem, which is why we always mention this when discussing water consumption recommendations, we always make sure to know if a person has severe chronic disease, they shouldn't drink water as others. They'll need to limit sodium intake, use diuretic. And the first symptom I mentioned, folks, which is very common, extremely common, and you might have You probably even have, if you're over 50 years old, you likely have this problem, and often we don't know the cause of this issue. Most of the time, that's exactly the reason, right? In fact, we don't know the cause, which we call idiopathy, but sometimes this problem can be a result of kidney disease. And this problem, folks, is high blood pressure. So if you have high blood pressure or are hypertensive, it's crucial to check for kidney-related causes. If you have high blood pressure, you must get a kidney function test, measure your urea and creatinine levels, and calculate your creatinine clearance, as high blood pressure can be a result of kidney disease. High blood pressure can be both a result and a cause of kidney disease, and it's one of the main causes of kidney disease here in Brazil. It's actually the leading cause, while globally, the main cause is diabetes, with high blood pressure being the second. Why? When the kidneys malfunction, there's an electrolyte imbalance of sodium, potassium, and calcium, which can lead to fluid retention, which will also increase blood pressure and activate a system called the renin-angiotensin-aldosterone system, which is directly linked to pressure, so much that antihypertensive medications typically target this system. How do we control blood pressure? First, maintain a healthy weight, exercise, limit sodium intake, and if needed, use blood pressure meds. Folks, that's the end of part 1, but we're not done. In part 2, I'll teach you how to prevent kidney disease. First, I want to give you some advice, okay? You don't need all symptoms to suspect kidney disease. If you have 2 or 3, be alert, seek care, and invest. Early diagnosis improves your chances of preventing progression. So the sooner you identify and treat it, the lower your chances of needing a transplant or hemodialysis. Now, with those warnings in mind, let's move on to our second part. How can you protect yourself from kidney problems? How can you prevent kidney failure? What should you do to avoid damaging your kidney? First, avoid non-steroidal anti-inflammatory drugs like ibuprofen, naproxen, nimesulide, diclofenac, and ketoprofen. These meds cause acute kidney injury, and long-term use can lead to chronic kidney disease. I've seen patients waiting for kidney transplants due to overuse of anti-inflammatory. Why? It's sold without a prescription. Anyone can buy it, and we see ads for it on TV all the time, right? But this medication shouldn't be used for more than 3 days without a doctor's guidance, okay? Fortunately, I see many colleagues prescribing anti-inflammatory drugs in compounded formulas for continuous use for 4, 5, or 6 months straight. In my opinion, this is completely wrong and will do more harm than good for the patient. This will hurt more than help that person. So, folks, don't use anti-inflammatories for more than 3 days. Doctor, I went to the orthopedist and he prescribed it for 5 days. Can I take it? Can I take it? Folks, 5 days is acceptable. However, taking anti-inflammatories for 15, 20, or 50 days straight is not acceptable. Got it? So you can't take anti-inflammatories daily, hourly, or 4 times a week every week. You can't. This will destroy your kidneys. Second fact here, another strategy to improve and protect your kidney. Don't overuse salt. Salt overloads the kidneys, excess sodium causes water retention, and what does this lead to? High blood pressure alone damages kidney filter. So before salting your food, remember your kidney health. Instead, use spices, garlic, onion, oregano, rosemary, thyme, pepper. These won't harm your kidneys. Don't have severe kidney issues. Try light salt. Personally, I don't like light salt, okay? At home, I use coarse or pink Himalayan salt, not refined or sea salt. Third habit, avoid excess sugar for the same reason as sodium. Sugar contributes to fluid retention. This raises blood pressure and pancreatic insulin secretion. Sugar also makes kidneys retain water and salt. Not to mention excessive sugar intake raises obesity risk, which is linked to higher chronic kidney disease risk. Next habit, avoid ultra-processed foods. So forget soda. They're rich in phosphoric acid, weakening bones, and increasing chronic kidney disease risk. Plus, ultra-processed foods contain everything bad in food. Too much sodium, sugar, saturated fat, coloring, and preservatives. They can even disrupt your hormonal balance. Next habit, eat real food. If you want to improve your blood pressure, diabetes, cholesterol, weight, anxiety, sleep, and kidney health without doctors, meds, or tests, I recommend reading my book, The Longevity Code, linked first in the description and pinned in the comments, because the info in this book will help you adopt the world's best lifestyle. This lifestyle will help control blood pressure, diabetes, and cholesterol. It'll help prevent chronic kidney disease, heart attacks, poor circulation, strokes, and cancer. I'll teach you everything you need to know to have the world's best lifestyle and live a healthier life with more energy and vitality without spending on doctors or tests, personal trainers, or nutritionists. Basically, everything you need for the world's best lifestyle. Click the first link in the description or the pinned comment to get your longevity code. 100 habits to live past 100.